Ronaldo's being very good with time has allowed his time for questions, so I'm going to open it up for questions of any of the panelists. And all right, his hand was up. I'll get the forum members in a minute. If you go to the microphone.
I'm Peter Donnelly, Professor of Public Health at University of St Andrews in Scotland. We have a drink problem in Scotland. I like the map. We're always really grateful to Russia because they make our drinking seem reasonable. It's fantastic. What we've been doing is a number of different issues, but the thing we've been battling for and eventually managed to get through Parliament was minimum pricing based on alcohol units. And that was important to us because we had the same phenomena that you have in Brazil, which was very cheap, very high alcohol content drinks available through off-licenses, local shops. In fact, our comparison was not with orange juice, but with mineral water. It was cheaper. It's cheaper to buy alcohol than mineral water. And when we pointed that out to the politicians, they eventually were brave enough to take this forward. The alcohol industry is pushing back and is challenging this in the courts. They're challenging it as a constraint on free trade, essentially. And just to tie the last two talks together in the context of the Scottish experience, I'm not surprised, Tobin, that the things that are being successfully progressed as policy are the ones you picked out, because they're the ones that don't cost the industry much money. Industry will always help you tackle drunk driving, pregnant women who drink. They'll quite happily marginalize teenagers, because to be honest, they don't make that much money out of those three groups. The real challenge with industry is to get them to accept that it's a population problem. And as you say, using the Jeffrey Rose paradigm, that what you need to do is actually change the total quantum of alcohol that goes through the population. But the exciting thing is they can still make money, actually. And the discussions we had with them was to try and get them to think how they could still make profit without pushing quite so much ethanol through the population. And a lot of these companies actually do have a plan B ready. It's just that at the minute, it's too easy to go with plan A and sell the cheap booze. But we need to keep pressing them into something more enlightened.
Thank you. Yes.
Thank you, Arturo Cervantes, Forum member. Thank you. I want to address in low and middle income countries, especially in the Americas, there's an epidemic of violence, a huge upsurge of violence, not only homicidal violence, criminal violence and delinquency, but also we have an upsurge on child maltreatment, on youth violence in schools, of intimate partner violence. By many measures, this is not exclusive to Mexico. Given the overwhelming evidence, and I congratulate the panel for a fabulous discussion of the risks involved with alcohol consumption, I think it is clear that alcohol is somewhat of a culprit. And as WHO has stated, it is no ordinary commodity. And also, you have presented overwhelming evidence of policies that are very effective and that work. However, I would ask us to question how we should think about the alcohol industry. So I think it's the equivalent of what has happened with the NRA in terms of guns. And now, as the book Alcohol, No Ordinary Commodity states, it's 5 or 6 conglomerates that are controlling the entire alcohol production, or the majority of the commercial alcohol production in the world. And they have such a strong political influence, specifically in low and middle income countries, where their governments are more, and their legislators are more subject to these practices of conflict of interest, where they are truly the industry acting with complete impunity. I believe this is not acceptable given the level of knowledge that we have about the density, the prices, the policies, and the regulations that work, shouldn't we be focusing on the larger mechanisms, whereas the global community could try to control or could try to be more effective in working with the industry? What happens is that if you leave this to local governments or to even to state or national governments, which are very weak in terms of the power that the industry conglomerates have and that they can exercise in local policies. And I say this because this upsurge of violence, at least in Mexico, is related to an incredible upsurge in alcohol outlet density and packaging availability throughout youth and complete lack of control. So I think it would be responsible that we think not only of the local policies, but of the major strategies that could be used to neutralize the extreme power that this industry is exhibiting for the negative effects of health and violence in the world.
Thank you, Arturo. Good comments. But I also want to point out, though, that unregulated alcohol is a bigger problem, especially in very low-income countries where the industry is not as embedded. And when you have alcohol that's not regulated at all, it's not sold by the major companies, and there's no way that it's there's any kind of regulation about the alcohol content and how it's sold and how it's taxed. And I think that that's a worse problem. I agree that there are many control policies that need to be in place, and that is why OECD even took it up. One of the important developments is that the United Nations has named reducing heavy episodic drinking as one of the four risk behaviors that they're focusing on in terms of lowering chronic diseases, non-communicable diseases. So it's alcohol consumption, tobacco, diet, and exercise. Those were the areas that were agreed on. So for a change, alcohol has taken, and the consumption of alcohol has taken a central stage. We're not just talking about reducing alcohol dependence. We're talking about reducing alcohol consumption. And I think it's an opportunity for countries to reevaluate their policies, which is exactly why OECD is trying to come up with this model so that countries could look at what would happen if they implemented certain things. And I think we need to make sure that violence is on that agenda as well, that you're looking for ways to reduce reductions in alcohol-related violence. Okay, Elizabeth.
Thank you to the panel. I think very interesting information. I'd just like clarification on two areas. For Tobin, of the policies that you put forward, what's the ranking in terms of effectiveness, and which ones? In other words, which are your top 5 and why, and what would you do? And the other thing for Ronaldo, while in Diaderma, I was wondering, while reduction in alcohol outlets density and time of it being sold was a very important factor, weren't there a lot of other major improvements that were done in the community? And wouldn't you say that alcohol was maybe the main factor, but these other factors were also very important? Maybe you'd comment on what some of those other things were.
Thank you. The list that I showed on the slide of the top 10 were in fact in ranked order. We published a paper in the American Journal of Preventive Medicine this past year that talked about the process we went through to rank policies. And not only did we look at binge drinking among general populations, but we also looked at policies and their impact on alcohol-impaired driving in the general population, as well as binge drinking among youth and alcohol-impaired driving among youth, and ranked all of our 47 policies on each of those factors, as well as looked at the strength of the evidence related to those policies. So one important factor in our consideration was certainly strength of evidence. but we wanted to be free of not to look at and provide a common metric for ranking all of these policies, irrespective of the strength of evidence, although certainly strength of evidence was very strongly associated with our ranking of policy efficacy. But we also took into consideration specific restrictions on each of the policies may have for access to alcohol, an important theoretical component, as well as the reach of those policies into large swaths or less or maybe smaller swaths, more targeted policies for smaller parts of the population, higher efficacy rankings for studies or for policies that had broader impact.
Okay, I'm going to ask Valerie and then Mark.
I'd like also to add a little bit about Nelson. I think for countries like Brazil, price is the main policy. Otherwise, if you implement any other policy, if it will have still very low price, I think the impact as a country as a whole will be very difficult to any other policy. What happened in the city of Diadema was there was a lot of things. They increased the numbers of municipal guards. They have events with the teenagers. They have lots of security measures that they do over the years, just before this law is passed. And we did analysis. We did a multiple variate analysis, and the closing of bars was the main event that made the curve of the decrease of the homicides. And of course, it's a combination of factors, but it seems that the closing of bars was the main event responsible for the decrease and of the homicides.
Good morning, and again, I want to reiterate that I appreciate the panel's presentations, and your work and your presentations really highlight the complexity of this issue, both as it relates to alcohol use and abuse and the interrelationship with violence, and especially among youth. I just want to underscore a couple of things, the issue of availability and the discussion on policy. A few years ago at the NIH, we funded a set of applications focused on children's exposure to violence. And one of those projects that we funded, actually NIAAA was the lead institute on it, funded a study where they evaluated the implementation of a policy. And actually, as the story goes, the investigator was brought in to evaluate a policy in a low to middle income city, Baltimore, where there was lots of issues with respect to alcohol exposure and violence. And she was invited by the city to kind of look at whether or not their policy related to the relationship of package stores and places where alcohol was sold to the schools. And there was supposed to be a certain distance between the schools and these places where alcohol was sold. And just in evaluating the policy, she found that the policy had neither been implemented well, and in the cases where it was, the extent to which it was implemented was very, very poor. And in reporting her data back to the city officials, they were able to make not only an impact in addressing that issue and implementing the policy, but they also saw a change in some violent behavior, exposure to violence issues in and around the school. And that led to it kind of had a ripple effect, led to other kinds of outcomes for children in that community. And I guess one of the things that I think we haven't talked about, we talk about the actual existence of policies, but to what extent are you aware of policies, their implementation, and the extent to which those policies are implemented, and whether or not attention to those details has had any impact on violence, especially in youth communities?
Yeah, I think that's a super important issue. There has not been a lot of attention paid to it. The policy research that has gone on has looked at policy as a dichotomous variable. It's there or it's not. It's far more nuanced than that. The research that we've been doing looks at not only efficacy of a policy implemented in its ideal form, but also what's on the books in terms of actual implementation in each of the states. And there's a variety of provisions that can make those policies stronger or weaker. So that's part of our research. We also, our group at University of Minnesota this past year has published a paper actually on a project looking at malt liquor availability in local areas and local policies, and looked at and tried to create a model because we have very little theory to guide us in how we do research in those areas. So developing a model of what are in fact the most important components to even consider and try and measure for future research. So that paper's out there and is helping guide some of the work that we're continuing to do on that very important issue, as well as our policy project in Minnesota, looking at not only policy, whether it's on the books or not, but the resources that are dedicated to enforcement. We know that one of the things, and the industry was brought up, there's been an erosion of support on tax base for the state level for alcohol beverage control agencies and enforcement. And we know that enforcement is a critical component for getting deterrence to happen effectively related to policy. If you don't think you're going to get caught, then why would you comply with the policy, especially when you're making a lot of money off of it?
That's a good point, Mark. I also just wanted to add to that it varies state by state. In Maryland, we have a governor who has effectively managed to get alcohol taxes raised, which is the first time since the 1950s that alcohol sales taxes have been raised. So a lot varies by state, and that's how we do a lot of our policy research. And we're hoping with this program announcement that NIH released that we'll get some applications that compare alcohol policies and reductions in violence by state.
Well, I want to first thank you, the panelists, and Peggy for putting this panel together. It was a tremendous presentation on the whole array of issues, from basic research through policy through implementation. And it was exciting to hear that. A number of kind of questions and comments, and let me just mention all of them, and you can answer any that you're interested in. For the first presentation you did, Ken, I thought that there was an elephant in the room when you were talking about the association with intimate partner violence and domestic violence, and that is the idea that alcohol is frequently used as an excuse for domestic violence. And I think it's very helpful to us to be able to separate whether we're looking at alcohol as something that justifies domestic violence versus whether there's a scientific effect on increasing aggression. And very often those two issues have been conflated and confused, but I think you're helping us to separate those two. But I think that notion of alcohol as an excuse for domestic violence has been a complicating factor, the elephant in the room. The second point I wanted to make is that the regulatory policies that Tobin, you explained for reducing the destructive impact of alcohol could be applied to other violence-related commodities. They could be a good model for applying to pesticides and pesticide sales and the density of outlets and reducing access. They could be applied to firearms, reducing the density of outlets and access of young people or high-risk people to these things, and they could be applied to illegal drugs. And we've been approaching these violence-related promoters one at a time. But the third point here is, couldn't they be used synergistically? We could have a bigger impact on violence if we approached in the way that Diadema did for alcohol sales and the way that a member of our forum, Rodrigo Guerrero, did for guns in Cali, Colombia. And if you could combine those two, you might have the biggest impact of all. But that's a new area for us to look at, policies that focus on violence with multiple commodities being involved in the approach. I think a third general question is there a combined effect of alcohol on people with mental illness? Klaus, you mentioned some of the synergies in certain diseases, deficiency states that we've identified biochemically, but we haven't looked per se what's the impact of violence on people with certain types of mental illness. And I suspect that's a very important area for us to look at. And of course, the effects will vary by the type of mental illness and the underlying state or condition, but that's another place where we should go. And finally, Ronaldo, I thought that was an extraordinary discussion in Diadema of how they didn't just think about and propose a policy, but they implemented it and put it in place. And I wonder if there are lessons to be drawn from what are the conditions in the city that made it possible to implement that plan. Was it that people were so frightened and affected by and scared of these high levels of violence? Is that a necessary precursor to implementing a policy like that? Does it make us think things have to get so bad before they can get better? Or are there other elements of the populace and the population and the social conditions at that time that made it much more effective to implement the program? Again, these are questions, we probably don't have time to answer them all, but I thought your presentations were so good and so compelling that they really helped light up the way forward. So thank you very much.
I would just like to address the expectancy thing, because that is it, in the full 2-hour version of this talk. I address that. You have to distinguish between the fact that violent people will use anything for an excuse. Distinguish that from whether the belief that a person can get away with violence because of drinking has any causal effect going forward. Okay, so those two different aspects. There's no doubt that people use alcohol as that they try to excuse their violence on the basis of alcohol. However, the evidence that has any influence on the alcohol violence effect that is very minimal. And the one thing I think that comes out from the studies of the various countries is that you see that effect in countries with really lots of restrictions on lots of normative impact on violence, as well as countries where there is not that kind of normative press on violence. And so there's a whole body of data that suggests that the belief that you could get away with aggression because you're drinking does not contribute to that alcohol aggression effect. And certainly the animals don't know that.
All right, we're going to have to end with Jackie. I'm going to allow her because she's the co-chair of the forum, so she gets special treatment.
All right. I very much appreciate the panel being put together and the whole breadth of what was addressed. All of you did a fabulous job. I learned a lot, and I thought I knew a lot about this connection. But one of the things I wanted to particularly note is Tobin's dichotomy there, that we have to work on both ends at the same time. It's not enough to do the population pieces. We also have to work on those high-risk folks. And of course, I always think about the domestic violence abusers who also have problems with alcohol. And I think one of the ways forward prevention strategies we need to think about is how we deal with those offenders. And right now, our policies around offender interventions for domestic violence offenders, also for child abuse offenders, does not well integrate those two issues. And there has been a clinical trial that was shown to be effective that combined Chris Murphy's work, that combined an intervention to do both, to work on both the, aggression issues without alcohol and the alcohol problems. But yet it's not very widely used. In fact, I don't know anywhere where it's being used systematically. And yet we have, and that's the kind of issue that we also need to work on, as well as the population-based alcohol issues.
If I could just respond quickly. The issue, particularly with the domestic violence area, has been that for years and years and years, they did not accept alcohol as a contributing cause to the violence. And so much of our efforts have been going the extra yard to demonstrate that. And now that I think that it's more or less accepted, I think that being able to see those kinds of policies implemented and doing some evaluations of them is much more possible than it was, say, even 5 years ago.
But I think Klaus, though, made a very good point to Dr. Insel and to NIAAA and others, is that we have been neglectful in this area. And we do, Mark, your question about how does alcohol add to mental illness, and we got a little bit from James Blair yesterday, but we didn't get enough. We see it in the epidemiologic data, but looking at the mechanisms is extremely important because it makes the case. I remember when the industry backed down on alcohol and liver disease, it was primate research. It was animal research that did it because we couldn't do it in humans. But it definitively showed that alcohol was related to liver disease. Believe it or not, there was a long period of time where the industry had everybody convinced that it didn't. So I think we have to do the same thing with alcohol and violence, and so we do need to increase the basic research, all of the research